I am Paul Leach and I'm a practicing GP in Stockport in Greater Manchester. And today we're going to focus on bone health. So, why bone health? Well, probably the most important thing about your bone health is that as you get older, your risk of having a fall increases. And if you're going to have a fall, ideally you want to make sure that your bone doesn't break. And whether that be something like a hip fracture or whether that be another kind of fracture, it can really have a devastating impact should you have a bad fall and sustain a fracture. So what can be done to try and promote bone health? From the age of about 40, all of our skeletons start to get less dense. So the bone becomes less dense, and therefore over time the risk of sustaining a fracture increases. And then going back to basics, keeping active and force going through the bone will stimulate the bone to keep remodelling and will slow down that rate of loss. So that's the first thing I would say, is keep active, keep moving and keep forces going through the bone. Now in order to build up the bone, you need the necessary minerals. So bone is a combination of kind of a scaffold structure made of things like collagen and then mineral that goes on top of that scaffold. And you need both of those things to be in place in order to have good bone strength. So calcium is an interesting one because calcium is really important and you need good levels of calcium to build up your bone. But at the same time, if you have too much calcium, then what can happen is it can get deposited within the arteries and actually increase the risk of heart disease. So it's about balance, but most people do struggle to get the amount of calcium that they need for the bones, especially as they get older. And what you can do is you can use something called a calcium calculator that you can find online and have a look at those and work out how much calcium that you're having and make sure that you're having the correct amount. Ideally, you want to be getting the calcium through your diet. There is some evidence if you have calcium and vitamin D together, that can certainly be beneficial if you're not getting enough calcium in your diet. But you need to be quite careful because too much calcium can be a bad thing. The next thing to think about is vitamin D. You can get it partly through diet and partly through sunlight. Most people in the UK are not getting enough vitamin D. And certainly the public health advice would be from September through to May, you want to be thinking about getting the vitamin D some other way than sunlight. Now, vitamin D has a really important role when it comes to bone because you need vitamin D in order to lay the calcium onto your bone. If you don't have enough vitamin D, that calcium won't be getting absorbed and it won't be getting laid onto that bone. Vitamin D supplements, as I say, I would personally recommend from September through to May. The necessary amount that you should be aiming for, certainly in those autumn and winter months, would be 800 to 1,000 international units, which equates to 20 to 25 micrograms. And most vitamin D supplements you buy from, say, the supermarket would have those kind of quantities in, but always check because you don't want to be having too little and you certainly don't want to be having too much. And as well as helping with bones, vitamin D also helps with things like the immune system, so it's really important to focus on that. What else is important? Well, and lifestyle things are really important there. So we know excess alcohol intake is a real risk factor for developing the consequences of having low bone density, which we call osteoporosis. Smoking is another lifestyle factor that's really important, so that will decrease the density of your bone and increase the risk of fractures. Other things, so certain medical conditions can increase your risk of having fractures. So things like an overactive thyroid that's not been adequately treated. We know that having an early menopause can increase the risk. And actually knowing these risk factors can be really helpful because they can give you an idea of do you need more in-depth testing to consider whether you might indeed have osteoporosis. So in terms of measuring the density of your bone, so how strong they are, the best way is a type of scan called a DEXA scan. So it stands for dual emission X-ray absorptiometry. So a DEXA scan looks at the two common sites where people tend to have fractures as they get older, and that's the hip and that's the spine. And basically, in simple terms, we shine a bit of radiation through those areas and we work out how strong your bones are compared to somebody of your own age and somebody of peak bone density, so somebody in their kind of at the age of around 30. And that's how we define. So if you're more than 2.5 standard deviations, and we're getting quite technical now, below somebody of peak bone density, so we call that T-score of less than 2.5, that's how we define osteoporosis, which is fairly arbitrary, but I guess there's lots of good evidence that shows that if you've got a T-score below that value, you're more likely to sustain fractures. So going to the hip, if you sustain a hip fracture, then that can have really a devastating impact. We know that 1 in 10 people who have a hip fracture will die within the first month, and we know that 1 in 3 people who sustain a hip fracture will die within the first 12 months. So obviously that's something that we want to try and prevent. With fractures of the spine, so what we call vertebral wedge fractures, what tends to happen as you get older is that the bones, the building blocks of the spine, the vertebrae, tend to collapse in on themselves. And you probably notice that as people get older, often they will develop kind of a hunchback or a hunched posture, and that's usually because of vertebral wedge fractures, which are related to osteoporosis. Now, we've spoken in terms of lifestyle factors that can be done to try and increase the strength of your bones, but as well as lifestyle factors and treating things that can increase the risk of reduced bone density, there are also medications as well, and probably the commonest medication is called the bisphosphonate. As you get older, your bone density will gradually decline. Now, as your bone density gradually declines, your risk of having a fracture goes up. And bisphosphonates, they work on the cells that break the bone down. So they bind to the osteoclasts that break the bone down, they stop them from working, and that allows the osteoblasts, the cells that build up the bone, to catch up a little bit. If you do have brittle bones, if you had a fracture, it's definitely a discussion to have with your GP, because there are pros and cons to taking medication. But for most people who've had a fracture, where it's because of brittle bones, i.e. osteoporosis, is something we'd definitely be wanting to talk about and definitely would be considering.